Let's have a quick conversation about cirrhosis. So, cirrhosis is a disease. It's a final stage of chronic liver disease. So, chronic means that it takes time to show up. So, typically, patients present of this disease in their 50s or 60s. All right, so I have like 3 words that remind me of the main things about cirrhosis. So, it's going to be a cirrhosis problem. Cirrhosis problem. Okay, so let's talk about the main causes of cirrhosis. So it's gonna be alcohol use, also hepatitis C, so C or Hep C, and also hepatitis B is an important another cause of cirrhosis. Okay, so now let's go back to letter A. There's more stuff to talk about A. So, patient with cirrhosis may present with ascites. They may show low albumin levels, and then also they may have anorexia because they don't want to eat due to this problem of cirrhosis. So, also for letter C, we may see that the patient will have caput medusa, which is enlarged abdominal veins due to portal hypertension. And then also we'll see coagulopathy because liver is having a hard time making the proteins responsible for coagulation. All right, now for letter, oops, sorry, there is no, okay, sorry. 1 second, let's fix this a little mess. So this was actually cirrhosis. Okay, that looks much better. Sorry about that. So now let's go back. So letter I will stand for indirect bili, which is gonna be increased. And because the liver is messed up, indirect bilirubin will have a difficult time to be conjugated to its direct form. So if we have indirect bilirubin, which is in large levels, we will also see itching in these patients because bilirubin will accumulate in the skin, and also we'll see increased INR levels, as we already talked about coagulopathy. Okay, so now R will stand for renal failure. Renal failure. And the other R will show us that these patients may have reproductive hormone imbalance, and specifically estrogen. All right, now we also may see reduced platelets and red blood cells. Okay, so letter H, very important here because you will see hepatoencephalopathy in these patients, which will cause confusion, altered mental status, as well as asterixis. All right, now they will also present with hepatomegaly. This is just my way to shorten this, hepatomegaly, and they may also develop hepatocellular carcinoma. Very not fun. All right, O will stand for osteoporosis. S will stand for splenomegaly, as well as spontaneous bacterial peritonitis and spider angiomas, which you will see on their skin, spider kind of lesions. And then the letter I will just stand for increased INR as a reminder again. And then also infections, not just SBP, but also increased likelihood, for example, for sepsis. Okay, and now I want to just emphasize the letter S, that we want to stop alcohol use in these patients as one of the ways to treat the disease. All right, now let's talk about the letter P. So P here will stand for okay, also 1 second, I want to say that the letter S here will also stand for skin changes. Skin changes. And what we will see, we know that there's going to be a lot of bilirubin in the blood, so we'll see jaundice, we'll see bruising. Remember, these people are not doing great with their clotting situation, and then we may see ecchymosis. Okay. Okay, now we can go to the letter P. So letter P will stand for portal hypertension, which we know causes a lot of issues here, like caput medusa. And also P will stand for paracentesis. Paracentesis, which is the way for us to address the ascites. Okay, now R here will stand for regenerative nodules, which is a sign of liver trying to maintain its function. And then R will also show us the right upper quadrant pain. This is where we can expect the patients to have pain with cirrhosis. O will stand for organ transplant, and of course that's going to be liver transferred. We want to get the liver transferred as one of the main treatments for these patients. All right, now B will stand for bleeding varices. Again, there is portal hypertension, so they may have varices. And then, okay, I am running out of space, but that's not a problem because I can change the color and just take this L letter and go here. So L will stand for lactulose, which is a way for us to address these patients' hepatoencephalopathy. And then also this will remind us about liver transplant as a way to deal with the disease, and it will remind us about loss of kilograms because these people will be anorexic, they won't want to eat, so they will actually have difficult time. They may want to eat, but they will have difficulty time to digest this stuff. Okay, so that was for L. And then E will again just tell us that it's going to be the alcohol issue causing this disease. All right, and then also estrogen. They will have increased estrogen, as I said. They will have imbalance in their hormones. So increased estrogen leads me to the letter M, because M stands for gynecomastia. So mastia, this is gynecomastia, and specifically for males, this will present as enlarged boobs. What do you call them? Yeah, you know what I mean. Okay, and then also M will stand for MELD score. So MELD score is something that we will take into account when we are considering whether this patient will get a liver transplant. Okay. So now, just to address some diagnostic things. So for diagnosis, we'll use US ultrasound with Doppler, and that will show us nodule liver surface. We may see splenomegaly and ascites. Then we also want to do CT or MRI, which will be helpful for us to measure the just to see structural changes, varices, and nodularity, and that's very helpful in portal hypertension and screening for hepatocellular carcinoma. And for labs, let's remember that platelets will be low, INR will be high, albumin will be low, AST to ALT will likely be, the ratio will be likely more than 2. And then just consider biopsy too, because if you have unclear etiology despite full workup, you want to make sure you are checking if these patients may have hepatocellular carcinoma. So that was it about cirrhosis.